Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 753,011 confirmed cases of COVID-19 in Canada and 256,960 cases in Ontario. Chatham-Kent has 1,103 cases, and Sarnia-Lambton has reported 1,782 cases. Michigan now has 551,000 cases and 551,080 cases, with 28,283 cases being in Detroit. Today we are reporting 53 new cases of COVID-19 in Windsor and Essex County. 8 are close contacts of confirmed cases, 4 are related to outbreaks, 3 are community acquired, and 38 are still being investigated. We have had 11,860 cases since March. 10,409 cases are now resolved, and 1,156 people are active cases at this time. 108 confirmed cases are currently in the hospital, and 15 people are in ICU. We are reporting 4 additional deaths today. 2 are from long-term care and retirement homes, a man in his 70s and a woman in her 80s. 2 are from the community, a woman in her 80s and a woman in her 90s. Our community has lost 295 people to COVID. 198 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 53 active outbreaks in Windsor and Essex County. 28 are in workplaces, 20 are in long-term care and retirement homes, and there are 5 outbreaks in our hospitals. Second round of vaccinations for residents, staff, and essential caregivers of long-term care homes and retirement homes will begin later this week. Despite the rollout of the vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members only, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. If you have any symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. Common symptoms include fever, new or worsening cough, barking cough, and chills. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. We have an opportunity here to get COVID-19 under control. Our cases are no longer in the 200s. Our vaccination rates for the long-term care home, retirement home is pretty high, and we are hopeful that it will help save our most vulnerable in the community. Many of you are aware of the supply challenges from Pfizer. This is impacting the vaccine rollout in Ontario. While Windsor and Essex County was one of the first to receive the COVID vaccine in Ontario, there are other regions that has not received any vaccine. In response to the limited availability of vaccine supply, the focus and attention is on the long-term care home, high-risk retirement, and First Nation elder care home residents. Since many individuals in our region already received their first dose, the government is ensuring that access to second dose of the Pfizer-BioNTech vaccine is protected for those who have received their first dose, following the advice of National Advisory Committee on Immunization, NACI, and maintaining the maximum interval of 21 to 27 days for long-term care, retirement home, and First Nation elder care home resident groups, and up to 35 days between the 2 doses for all other groups. So far, there is no indication that there is any supply challenges with Moderna. We are keeping a close eye on the vaccine supply to ensure that all our long-term care home and retirement home residents receive their 2 doses of vaccine, and anyone who have received their first dose complete their second dose. As a region, we continue to work on our vaccine rollout plan despite the ongoing challenges with the vaccine supply. We are working with all our partners to ensure that we are able to vaccinate all our residents in the most efficient manner. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. We are hearing, like you're saying, sort of a bit of panic across the province because of the shortage of the vaccine, but will we really be affected here because we are using the Moderna vaccine for long-term care retirement home residents?
So I can tell you about the Moderna vaccine that we are using for the retirement home residents and the staff and essential caregivers that were given the first dose of Moderna will be getting their second dose. I know I said this yesterday, we are scheduled to receive our next shipment the week of February 1st, but we have been assured by the province that that shipment will come to our freezer in Windsor-Essex. So we feel confident that we'll be beginning our second doses on the 28th, which is in a couple days, and we'll continue moving forward and get everyone vaccinated. We do have residents that, due to the outbreaks, and we've talked about this before as well, due to the outbreaks, they haven't received their first dose. So we're monitoring all of our doses to try to make sure that even the residents that have not had their first doses will be able to vaccinate them as well. So regarding Moderna, we're in good shape and we're monitoring everything very closely. So, but we are on all those conversations in those meetings with the ministry, making sure that we're focusing on the priority right now, which they've been very clear are the residents of long-term care and retirement homes.
Okay, thank you.
Any questions from AM 800?
Teresa, just looking at the resolved cases for today, quite a jump from yesterday, over 400. Is that one of the highest we've seen in a single day?
It could, I don't know, but it could be. But we are making a lot of progress, and as people recover, and in these, especially in outbreaks, when there are groups of people that have, that have have COVID all at once, and as they recover within 10 days or sometimes longer, depending on how ill they are, then we are getting these. We can get these big groups as we're seeing today. So yeah, today's a good day with the numbers and the progress, and it was good to see everything kind of working together today.
Dr. Ahmed, I know we still got a long way to go here, but just seeing the numbers, obviously the resolved numbers, that's a huge jump today. Even the active cases, that's going down. And looking at the outbreaks, there's no longer any outbreaks in the considered community. I know still got a long way to go here, but it seems like Windsor-Essex is making quite a bit of progress right now.
Yes, Rob, I think that's where I was focusing on, that we do have that opportunity to turn things around. We did exceptionally well in September, October months compared to the rest of the province, and I do feel that we can do it again. We are on the right track with all these additional restrictions, stay-at-home orders. It is working because it's limiting the number of people interacting. There's still anecdotal evidence that people are still out and about, which is another story, but I think a majority of the people are still following these recommendations and guidelines, and that's the only way we can beat this virus and we can turn things around. So I am quite optimistic looking at these case counts and the number of active cases, seeing it standing at 1,156 cases that are currently active, down from 2,600 cases. I think that was last week sometime. So that's a big jump, and we do want to keep making these progress. With less number of new cases and more cases being discharged, we will be in a much better position. And I really hope that we, before it all ends, the provincial emergency declaration, we are in a position to start to reopen our community as quickly as possible.
Thank you.
Any questions from CTV?
Yes, good morning. Hi, Teresa. Hi, Dr. Ahmed. I hope you're all well. I'm curious here. So the assessment center, the numbers are dropping. So there was an average of 500 people visiting the assessment center a day right around Christmas time. It was pretty consistent. And now I'm being told that it's less than 300 a day and sometimes even as low as 250. So just want to get your take on that. Why do you suppose the numbers are dropping as much as they are?
So a couple of reasons, Rob. If we look at our weekly average of cases, and I reported that on Friday as well, our weekly case count hasn't changed. It still is close to 11,000 cases. 11,000 tests that were done last week, and despite that number of 11,000 cases, our percent positivity was going down. So I think when it comes to the assessment center, and as we know, the assessment center, people go to the assessment center if they are symptomatic and if they are coming across with someone who is a confirmed case. With less activity, with more closures, with people staying indoors, the likelihood of people developing those symptoms or coming in contact with anyone would be low. So that would be one of the reasons that you may not see that many high number of people going into the assessment center. You can imagine that if people were out and about in December timeline, they were going to parties, they were going to shopping and all those other places, they may have that feeling that they want to get tested. So you would see those numbers going high. But at this time, you may see that because of less interaction, there will be a lower number of people going to these assessment centers. So that's what I can think of at this time. I would strongly encourage anyone who is having symptoms or who has come in contact with a confirmed case or a suspect case of COVID, they should get tested. I think that's the message, and we don't want to give out any different message. We want people to get tested, but the right people should get tested. So far, from a weekly average perspective, that number hasn't changed significantly. We'll have to come back and look at those numbers again this Friday to see if there's any changes that is reflected as an overall average. Day-to-day fluctuation, it happens all the time.
Well, I guess that leads me into my follow-up. So I don't know if this is a scenario, but maybe it is. Are you afraid that people might be afraid to go in and get tested because they might come out with a positive and then they have to miss work? Is that even a scenario? Have you seen that?
Well, we can anticipate that scenario, especially in people who are working and do not have paid vacation time, paid sick time. So I think that's the challenge that has always been there. That's why when we are looking at the provincial data, especially in the communities or in the neighborhood that are low-income neighborhood with some challenges with having all these sick leave benefits and sick leave plans, you can anticipate that these challenges would exist. But there are a number of programs and there are a number of support systems that is currently in place to support these individuals. So we strongly encourage people to look at all of those options, especially if they're concerned about their livelihood, if they're concerned about their income. There are a number of programs that are out there and people should be looking at it instead of compromising that and putting their own health and others' health at risk by tending to work while they're sick.
Okay, great. Thanks for that. I have another topic, but I'll throw that one out there on the second go round. Thank you.
Okay.
Any questions from CBC?
Hi, good morning. I have two questions regarding the vaccine rollout. I'm wondering if you can say or estimate how many people at long-term care and retirement homes have been vaccinated overall, and how many people have yet to receive that first dose?
So I can give you an estimate. I cannot give you a firm answer. I can say that on an average, we have at least 80 to 85% of all our long-term care home and retirement home residents that are currently vaccinated with first dose. The second dose will start in January 28th, as Teresa mentioned. The individuals who have not been vaccinated, it's not because of our inability to vaccinate them. It's because we have more than 300 cases that were active in these facilities. And when we're saying that someone is active, they cannot get the vaccine. And they have to have their symptoms resolved. They are clinically well enough to receive the vaccine. So only then they can receive the vaccine. So once they are ready, we are ready. We have the doses for them. And if they are willing to receive their shot, we will be giving them the shot. So our goal is to maximize the number of people who maximize the number of residents to receive their vaccine up to as high as 95%. So that's our goal, but recognizing that there will be some people who may choose not to receive the vaccine, or some people who may have a medical reason for not to receive the vaccine. But our goal is to make sure that we vaccinate everyone. We are monitoring that situation very closely. Anyone who is recovering and they're interested in receiving the vaccine, and logistically, if it's feasible for us, we are vaccinating them immediately as quickly as possible.
Thank you. So this month there were 7 new outbreaks declared at long-term care and retirement facilities. I'm wondering if you have a sense of how the virus is still getting into care homes at this stage. Wondering if you've identified any, vulnerability, any other, factor that is contributing to those.
Well, I think we've come across with this question many times. The real challenge is we also have to recognize that people who work in the long-term care home and retirement home, they're also people. They also live in the community. They're also exposed to same kind of risks and challenges that everyone else has. When you have a high rates of cases in the community, you will anticipate that some of these workers who work in these facilities will contract COVID and then will go on to pass it on to anyone else who they are coming in close contact with. So all of these IPAC measures, all of these audits, all of these personal protective equipment practices are critically important to prevent those type of spreads. And some of these cases that we are seeing right now, we are result of close contacts, or sometimes there is nothing that we can identify as an epi link to these cases, but things are getting better. We are looking forward to rescind outbreaks in many of these facilities in the coming days, and I'm confident that with more and more homes vaccinated, large number of their residents and their staff, we should see a decline in the number of outbreaks and even the number of cases in these facilities. That's the ultimate goal. We want to protect our most vulnerable in the community, and we will continue to work towards that goal.
Thank you so much.
Any questions from Blackburn?
Well, I don't know if there was any update on the investigation possibly linked to the death after the vaccine.
At this time, I don't have any update. It's with the coroner's office. There are a number of steps that they have to go through before they release their finding. We are working closely with them, and as soon as there is something to share, we will share. But as I said, most of the time, these challenges, these investigations are limited by the personal health information. So we'll see how much we can share once we are able to share.
And I guess I've had some questions from some readers who said, you do this investigation after somebody passes away, and you can't say that it's linked directly to the vaccine, but when it's, linked to COVID, it's automatically listed as a COVID-19 death. Can you respond to that? Maybe just let people know why it is that, deaths are categorized in a certain way, or why you can't maybe link the death to the vaccine directly?
So good question. So every time when we are thinking about any of the epidemiological concept, a case definition is really critical, that how we are defining a case. Similar to how we are defining a case of COVID-19, and then similarly, if there is a death that happens as a result of COVID, how we are defining those deaths. Those definitions are important to capture the information that we need, and as we learn more and more, we refine these definitions. With COVID being the new disease, and then the whole histopathology, that histopathological changes that goes in a human body as a result of COVID, there's still many things that we don't know. And as part of those definitions, and again, those definitions are not set by me or anyone else, those are all provincial definition that is set up by the coroner's office of Ontario. They define how each of these deaths should be captured. And as I said, more broadly, sometimes it's broad enough to capture everything, and sometimes it's narrow enough because when we know more about the disease, then it catches that part. The number that we are seeing right now with the vaccine related deaths, I think we have to really understand that how someone dies as a result of a disease versus how someone dies as a result of the vaccine. There's not enough evidence to suggest that vaccine related deaths happen. There are adverse events that happened which are documented based on the clinical trial, based on all the information that we have, and as a result of that, we know if we're experiencing any particular type of adverse event, whether it can be linked with the vaccine or not, and then what are some of the next steps that we have to do as a result of those adverse events. So we know when we have that much details, our definition is narrow. When we don't have that much details, our definition is wide enough. So that's why you see that anyone who has who's positive with COVID, and if they die under a certain period of time, they're identified as a COVID-related death. And then when you're seeing something which could be questionably as part of adverse event related to vaccine, that's captured, investigated, and reported back. There's a lot more opportunity for us to investigate, and if we see any pattern, if we see any number, that number is reported back to the community and added into the provincial as well as the national database and as well as the international database, because vaccine safety is critically important, and it's being monitored at all levels of the government and internationally to ensure that we're not doing any harm and maximizing the benefits.
Great, thank you.
Any further questions from the Windsor Star?
Yes, perhaps this is the pessimist in me asking this question, doctor, but we saw case counts shoot up very high very quickly and stay high for quite a while, and now they seem to be declining very quickly as well. Should we be at all suspicious by these numbers, or are they truly a reflection that the prevalence of COVID in the community has declined this much?
No, that's not being pessimistic. I think that's being realistic, and I always struggle with that question as well, because I want to see too that we're not ignoring something that's right in front of us and just by looking at these numbers. But again, you have to take that into consideration. First of all, if you're seeing a decline, you have to understand what could be the potential reasons for this decline. We know that our community has been in lockdown since mid-December or sometime mid to late December. It's been a month that we are in lockdown right now. So the number of interaction, the number of the potential reasons for people to spread the COVID-19 virus is very limited right now. We could have anticipated that there may be number of gatherings that happen over the Christmas time, over the holidays time, but now you should start to see a decline in many of these activities. And when people are not meeting, that's when you start to see that the transmission in the community is going low. And on top of that, the other important indicator that you have to look at is the person positivity. So person positivity, at one point we had the highest person positivity, but over the last Friday, I reported that the person positivity is declining as well, so that people are tested, but the number of people who are coming back positive is low. So that's another indicator that there is something else at play too. And then the third part that I mentioned, which is again, it's in the research phase, but looking at the sewage data. When we are looking at the sewage data, we're also starting to see a trend in declining the number of SARS-CoV-2 virus in the sewage water. So all of these picture, if you try and paint it together, it would all make sense. But again, it all is always dependent on the people following these guidelines. And as long as people are following these guidelines, we should continue to see improvement in our community. And we all know, all of us, nobody wants that. Nobody wants a high transmission rate in the community. Nobody wants to stay home all the time. We want to make sure that we get to a better stage and we continue to follow the public health measures, and we continue to get back to some of the things that we can, especially in this pandemic time. So it's not a pessimistic thought. I think it's a realistic thought. We have to understand that what is working and how we can continue to keep things better.
Okay, thank you, Doctor.
Any further questions from AIM 800?
No, thank you.
CTV?
Yes, doctor, I don't know about you, but before this pandemic, I never pictured myself wearing a mask every day. Now we're doing it every day. Now there's talk about double masking. So, with the new variant out, I guess it's understandable. Is that advisable? Is that something, you would advise to do? What's your take on all that?
So I don't think that double masking is a viable solution. So if you go back to what the advice from the Chief Public Health Officer for Canada, Theresa Tam, is advised to, even for the general public, to wear a 3-layered mask. So 3-layered mask is sufficient enough to protect this source, that if you are sick, you're unable to pass it on to someone else. And then the key piece is mask is just one component. You have to understand that you have to realize that if you're sick, stay home. You do not need to meet with many people. You have to stick to your household contacts only. And even if you are coming in, if you are in a situation where you're seeing someone who's outside of your home, who doesn't live with you, you always have to maintain your 2 meters distance. So those are the key things. Hand washing, ensuring that you're washing your hand frequently and thoroughly. You are protecting that. So you have to have all those measures in place. You cannot rely only on the mask piece. So that's the key message. Specifically talking about wearing double mask, the challenge is the more you touch your mask, the more you interfere. You're more likelihood to cause more harm than doing good by contaminating it and wearing 2 masks and then feeling that, oh, you are safe, and then people they start to get into some of these risky behavior. So that's why I want to focus on, yes, mask is important for source control. It doesn't protect you from when others are not wearing the mask, or if you're in a close proximity. So you have to have all these additional layers of protection. First of all, stick to your people at your home. If you're sick, stay home. If you're meeting outside people, always maintain your 2 meters distance. If you cannot maintain your 2 meters distance for a short period of time, wear a mask where you can protect from the source for everyone.
So do you see something like this happening because of this new variant, or I don't know. To me, it just seems like, I don't think it'll happen myself, but I'm not the scientist. So what do you think?
Yeah, well, I don't think that I haven't seen anyone yet, but I don't spend a lot of time outdoors, so I can't even comment that if people are wearing double masks. But I think there is no evidence to say that if you are wearing a double mask, especially in this type of variant situation, that would be more protective. I think the key part is despite the variant, the virus is the virus. The way this virus spread, it is same. It hasn't changed. So you would not anticipate any difference. The only thing that would be different, that maybe your interaction time could be shorter. So generally we say, if you are having an interaction for more than 15 minutes, then there's this possibility that you might be exposed. But this variant, you may see that, it doesn't take 15 minutes. It could be less than 5 minutes, or it could be even shorter. So those are kind of the things that you have to be mindful of. But everything else, you have to follow all those guidelines. It's not just one thing that would change the behavior of this virus.
Yeah, okay. Thanks for that. Appreciate it. Have a good day.
Thank you.
Any further questions from CBC?
No, thank you.
Blackburn?
No, thank you.
Thank you, everyone. Have a good day.
Thank you.